A movement called Make America Healthy Again sounds like something most parents would support, but what does it actually mean and who decides? As long held ideas about kids' health are being questioned, we're taking a closer look at what this debate could mean for families and kids. This is Child Health Advocacy and Policy, a podcast from Rice University's Baker Institute. We go beyond the headlines to break down the decisions shaping kids' health in ways that matter to families. I'm Dr. Heidi Russell. Children's health in the United States is at a crossroads, with rising chronic illness and growing debate over what kids eat, how they grow, and the care they receive. At the same time, a new movement, Make America Healthy Again, or MAHA, is promising big changes. Suddenly, many long-standing assumptions about children's health, what's safe, what works, and who to trust, are being questioned in new ways. If you're a parent trying to make sense of it all, you're not alone. Today, we're unpacking what MAHA is and what it isn't. We're going to dig into what it says about children's health and why turning big ideas into real-world change is harder than it sounds. I'm joined by Elena M, a senior fellow in health policy at the Baker Institute and longtime advocate for health system reform. Let's get into it. Elena, thank you so much for being here today. Just to start, can we put the MAHA kind of concept into perspective? Is MAHA something formal? What is it exactly?
I think MAHA originated the term MAHA as sort of a play on MAHA, to Make America Great Again. The health version of it became known as Make America Healthy Again. It's not an agency or an entity, but it is a slogan under which the federal government, and particularly the Health and Human Services Department, is putting a lot of its emphasis on how it's going to change the way the agencies have functioned historically.
So the concepts that come out of MAHA or whatever the organizations are around those might have the potential to change policy or direction of these agencies?
Yes, and it, of course, depends on how it's implemented. I mean, you can say whatever you want to say about whatever you think and believe, but ultimately for health change, which is what would impact people's lives, there are a lot of different ways to do that, whether it's through passing laws, changing regulations at the agency level. A little bit of work can be done at the executive order level, and a lot of work would need to be done at the state level. So you can have these ideas under this concept of MAHA, and the publications that have come out largely are in that venue, sort of where these are big ideas. Actual implementation of the MAHA agenda is really complicated and will take a long time and a lot of different involvement by different agencies and levels of government.
That's really important information because I think we look at these and say, oh my goodness, all this stuff is changing, but the implementation is really going to matter over the next few years in terms of how they impact our services to our population and our funding streams and that sort of thing.
If funding streams don't change and the regulations and rules that go along with those funding streams don't change, then pretty much everything will remain the same because we implement by paying for withholding payments for certain things that we want to see.
Yeah. Well, let's get into some of the very specifics of these, how the MAHA Commission in particular, which is a group I think of the cabinet, they've put out two major reports that reflect specifically on children and children's health. The first one came out in May of 2025, and it's a description of what they think are four major drivers, is what they call them, or opportunities to change the course of childhood chronic disease. And I'm going to list them just so we have them listed, and then we can talk about them a little bit more. So one has to do with the poor diet. Another is chemical exposure. And they're mostly talking about environmental chemical exposures. The third is lack of physical activity combined with chronic stress from a variety of factors. And the final major one is over-medicalization for a variety of healthcare reasons. So that came out in the first report. And then they came out with a second strategy report in September 2025 that included over 120 recommendations for reforms across federal and state agencies. We're going to link those reports in the show notes. I think they are a pretty interesting read to how this group is thinking about reform at all levels. One of the interesting things that I see as someone who's been through a lot of guideline development and health guideline kind of creation in the healthcare industry is that this report came out just a few months after President Trump's second term started. And it came out after the appointment of Robert F. Kennedy Jr. as head of Health and Human Services. And so there was a really short timeline from the election or from the Trump administration starting to the production of this report. And I'm curious, what do you think about that very short timeline in terms of the report itself and the evidence behind the full points they make and the recommendations they made afterwards?
Well, if we're talking about the May report, and that was uh, an executive order that said you have 100 days to put out this report, um, that's really not a lot of time to put together something very comprehensive. And when you look at the report and you see how it's organized and how it's written, you can sort of tell that they had to rush to put it together to meet the deadline. The top line pieces of it that you mentioned, the poor diet, the chemical exposure, lack of physical activity, and over medicalization, I think are very legitimate topics. And actually, when I first looked at that, considering a lot of my work is about how do we improve health and not just do more medical care where we spend so much money and get relatively poor outcomes, I thought, well, this could be good. But as you dig into it a little bit more, what becomes apparent is that it is a manifestation of many of the pre-existing ideas that RFK Jr. had. The people who helped put together this report, you can see what they did was try to find evidence to support the pre-existing biases and conclusions of RFK Jr.
Yeah, so there might be other things that are more relevant to the health of children that are not included in this report simply because we don't know what they excluded or why they picked those besides personal interest or potentially bias.
The way a report like this would typically be conducted is you would have enough time, which probably would be at least 6 months, I would think, for even their preliminary assessment to come out. And you would have a diverse, broad team of qualified researchers. And while you may start with a hypothesis, a lot of research begins with a hypothesis. You wouldn't start with the conclusion, and you would ask those researchers, what are the most important factors that are driving poor outcomes for American children? And then you would go from there. And this is to be organized around ideas that he had about things that were important. And it's not that I disagree with the items he picked out. The issue is whether we would have seen something different if we had done a broad, traditional survey of the relevant information, and then we prioritize what we were going to do based on what the data showed, as opposed to based on the particular opinions of one person.
Good points. Good points. And that brings us then to the implementation. We know, as we just talked about, the way in which the original report was structured wasn't necessarily founded on a structured evaluation. When we go to looking at the policy recommendations, are those done differently, or is there some evidence behind some of the 120 recommendations?
The SAHA report, which took another 3 months and was supposed to really give the detail of a strategy for how you implemented the necessary changes to the four big bucket categories, looks similarly organized. It contains a big, broad list of stuff, doesn't necessarily cohere. Let me give you one specific example. Food is a big category from the first report. It's also, I think it's a huge category. I think we have amazing opportunities to improve the health of American children by addressing what they eat, when they eat, where it comes from, and all of that. And so I was really excited to see that. Kennedy, as we know from a lot of the conversations and its public statements, is obsessed with what some people call ultra processed foods. Of the recommendations he makes in the first report and in the second report, talks over and over about UPFs, as they're called, over and over and over. And yet, we down to the specific things to do. One of the things in there is to define UPFs. And
Yeah, but he seems to have already defined it in the original report based on his preconceived notion of what that is.
exactly. You say, I believe UPFs are X, was whatever it is that he considers the definition. If there's not already a consensus definition among researchers, and then you would go from there. But he has spent, or the courts spend a lot of time going after how we've got to eliminate UPS from our grocery store, the restaurants, particularly the lives of children. And yet we don't know what they are.
And we've seen some of the state governments that are already kind of on board with the MAHA movement, even before these reports came out, started making some changes, especially around food. We've seen those with SNAP benefit changes. Of course, they're different at every state. So this raises some other kind of bigger questions about whether we know which activities are going to be best for children. If one state changes food in the schools where another changes specific SNAP benefits, how are we going to know whether or not children are bettered by these policies? Texas passed a bill that changed SNAP benefits. And it was interesting. One part included a different definition of ultra processed, and the other limited that definition. Going back to these multiple layers of different policy recommendations, it seems like a lot of these are focused potentially on how states behave, on how states actually implement the things that are under their control. For example, how they provide their food in schools, how they regulate SNAP benefits when we're talking about food. Again, many of these things are at the state level. What is the challenge here? We've got federal recommendations for policies, but states have to interpret them. What does that mean for whether they're going to be of value, or the challenges to actually implementing anything that's in this report?
Well, it sounds attractive at first. States tailor the rules to fit their own states. But as a practical matter, when you're talking about things like the U.S. food supply, it doesn't happen state by state. For example, Texas passed a law this last legislative session regarding labeling of certain food items. They borrowed a list from Europe and said, this is what we're going to require labeling for. Well, the food that is sold in Texas grocery stores and restaurants, and even the food that comes into our schools and that SNAP dollars are used to pay, aren't made just for Texas. And so the question becomes, how do you get the food companies to do that? If they're not able to do that for this state because another state has something different, do we suddenly lose all of our access to those foods? And they may be foods that we want. We just want to label them a particular way. I think we have a lot of uncertainty about whether these good-hearted ideas, like people should know what's in their food and they should have healthy foods, how they're actually implemented. And I think part of the issue with these reports is that they threw out some good ideas. I think they threw out some bad ideas as well, but they threw out some ideas, but they didn't do enough about the path for implementation so that we will be successful as a country and state by state.
Being successful raises a really important question for me in how these policies sit with the rest of the behavior of Health and Human Services, and actually the Trump administration's behavior overall, both with DOJ and then the direct agency, and within this policy too. So we have a series of policy recommendations that need to be implemented, and then we need to know whether they matter. While simultaneously, we're seeing defunding of groups and organizations that would do that assessment of whether they matter, as well as recommendations for deregulation in those same agencies that they're also suggesting need to change or increase regulations to meet these guidelines that are these policies they're putting out. Can you help me put all of this together in a make sense way?
This is part of the many inconsistencies within the report and between the reports and real life. If they are making cuts to many federal agencies, the ability to implement some of these changes through the agencies is going to be compromised. The people simply aren't there to do that. They have also, at the same time, the report is calling for more investment by the EPA to look at the impact of environmental pollution on children's health. You're seeing the EPA change its regulations to deregulate a lot of them. So at the same time, you want to know more so that you can control it better if there is a health impact. You see the EPA say, we are no longer going to consider the health impacts when setting certain pollution standards.
Sounds like we're going to struggle with following some of these policies and some of these recommendations and knowing whether or not, if we implement them, that they matter. I don't disagree with many of the recommendations or many of the directions they're going. I'm more concerned about being able to actually do them and know that they matter.
If there's no evaluation or research accompanying changes in policy, then you just don't know what works. To really figure out what's working for whom, under what circumstances, and at what cost and with what benefits, it takes some real research. There's nothing in here that seems to say we are going to fund the rigorous research that is necessary to determine whether our hypothesis is correct. The courts spend a lot of time criticizing the scientific establishment, but they're not offering any alternative for how might actually assess whether something works or not.
Right. And we at the Baker Institute have been looking specifically at which scientists are producing the information that they're using in these reports. And so much of it is coming from the federal government. Defunding those mechanisms of identifying the frequency of autism or the rate of obesity or the rate of long-term diseases, that's all government data. Some of it is interpreted by the government itself, and some of it's interpreted by scientists funded by the federal government.
I think that's right. And it goes back to not having a hypothesis that you're testing, but having
Right.
your preconceived conclusions and then finding pieces of information that support that. One of the points in both of the reports in the criticism of the current scientific enterprise is that the evidence has been skewed by corporate interests, medical journal industry capture, and things like that. The one place that can do straight up public interest research or fund it and control for it, as you just said, is the federal government. Everybody has some interest, right? I mean, food company, food. The polluters don't want to pollute, but they do want to manufacture and sell it at what their product is. And if they don't have the NIH or other government agencies who are studying the standard for research and holding researchers to it and doing all of that in the public interest.
Before we end, I have one more question, which is, if you were able to give one piece of advice to our listeners to start untangling this report or this information coming out around this, what would you recommend?
People ought to read it. I would recommend that people take a look. Some of it is technical, but a lot of it really isn't. And then I would recommend that you follow our work and the work of other independent experts who have credibility and see what they're saying about this. It's not all good. It's not all bad. And you can make your own choices, and we're here to help you understand how you might do that best.
Wonderful advice. Thank you so much. Child Health Advocacy and Policy is brought to you by Rice University's Baker Institute, which provides meaningful, nonpartisan policy analysis on the most critical challenges facing Texas, the U.S., and the world. You can find links to everything we discussed today in the show notes. This episode was produced by Caitlin May, with additional support by Leslie Marie Aguilar, Ed Bailey, Shannon Moriarty, and Kevin Young. Check out our other podcasts, latest research, and events at bakerinstitute.org. Thanks for listening.